Now, I was in your office, and I saw you had something that looked like, to me, like a retainer. And you would explain to me, for those individuals who have spaces between their teeth that they didn't like, they can use this little thing they put in their mouth like a retainer. Can you explain that a little bit?
You're referring to the appliance that can be used to put over the teeth that can change the shape of the teeth and the color and fill in any spaces?
Yes.
Okay. That is something new that's just come out. It's fabricated by a very good dental company that's been around a long time. It's called a Snap-on Smile. And the Snap-on Smile is an appliance that can be designed from impressions or molds of the mouth that the dentist takes, and it snaps on over the teeth so that patients that don't want to go through a lot of expensive dentistry right away, but have engagements to go to and they want to look presentable, it can be made for the top or the bottom or both arches. You can change the color of your teeth to very white teeth. It can make the teeth longer or shorter. If you have slightly rotated teeth, it can make everything in their proper alignment so all the teeth look even. If you have a space, it can fill in the space. And it's sort of a prelude to the definitive treatment. This is the same company that has pioneered the porcelain laminate veneers over the years, which a lot of dentists do as makeovers. Patients that want to change the size and color of their teeth can get the porcelain laminates, but the porcelain laminates are much, much more expensive. But they can really make a big difference in the way you look.
So the young kids today are getting their tongue pierced or their lips pierced and this and that and the other. How does that affect the overall health of the mouth to have their tongue pierced or their lips pierced?
Well, most dentists are not too fond of piercings. The lips or the tongue, I don't think it would affect the overall health of the mouth as long as they're maintained well. And there's a lot of young people that do have that, mostly for cosmetic reasons. But it has one good point. It can be removed, and it can be removed from time to time, and the mouth can be given a rest. But if you remove it for too long, naturally, the hole closes up and you can't get it back in again. So most of those patients do keep them in. And some of them find it difficult to remove after they put them in, although they removed, and we usually do that when we take x-rays and the like, because the metallic composition of these things do affect the x-rays, especially the panoramic x-ray, which is the x-ray that's taken from outside the mouth. These metallic objects in there can cause over the tooth structure, and we can't really see cavities as well as we'd like.
Let's talk about fillings. Okay. Some of us have had, as a child, we've had fillings put in. At some point, does the fillings have to be removed, or do they kind of fall out? And if that happens, what happens? What's the next step?
Well, traditionally, what's been used on the back teeth over the years is amalgam fillings or silver fillings.
Right.
They still have probably the longest track record for back teeth, for molar teeth. They're very durable. You can get a good 15 to 20 years out of a good silver filling, provided that it's maintained and you don't develop any cavities around it. Okay. The other type of fillings that can be used are composite fillings. These are very cosmetic, and now they have some very good ones that can be used on not only the front but the back teeth as well. These fillings are the same color as the teeth. They don't last as long as the silver fillings. On the front teeth especially, they're used on the front teeth for cosmetic reasons because I don't think many people would like to go around with silver fillings in the front of their mouth.
No, I don't think so.
You can match the color of the teeth very nicely, and usually about 5 years is what you can expect on the front composite fillings before they need to be replaced. And usually what happens with those is they start to discolor and crack around the edges.
Oh, I didn't know that. Oh, okay. So that's good to know. Well, for children, as they start to get their permanent teeth, I had heard that there was something to put very, very, very similar to when people get their nails done. They get the
You're referring to the pit and fissure sealants.
Yes.
The pit and fissure sealants are usually put on the permanent teeth of children, mostly the molar teeth, the first and second molars. When these teeth first erupt, usually if the tooth has a very deep groove in the biting surface, or where the central fossa, as it's called, is, the pit and fissure sealant is sort of like a bonding material that bonds directly
that's what it is.
to enamel, and works very well, is very durable. If it chips off for any reason within the first year or so after it's put on, it can be redone, and it works very well in preventing decay in the deep fissure of the tooth.
Now, what is it advisable to have that done for the child, or to just?
Yes, it is. Usually, when the first year, when the 6-year molars or the first permanent molars erupt, it's the time to start doing it. And then when the second molar comes in, you can do it on that tooth also. If the child is coming to the dentist every 6 months on a regular basis for cleanings, sealants can be done at that time. And most insurances do cover that as well.
And what's the benefit of this?
The benefit is to prevent, it's preventive. It prevents cavities from developing in the biting surfaces of these teeth.
Oh, okay.
Works very well.
Oh. Now, let me ask you, now, you yourself, you are a surgeon as well as a regular dentist, correct?
Yes, I am, Pat. Now, as most specialists, in order to be a specialist and advertise yourself as a surgeon, you have to confine your practice to that specialty. Now, I am a board-certified oral surgeon. I did my surgical training at Harlem Hospital in New York and Columbia Presbyterian. I got out of a 3-year surgical residency as chief resident in 1975. I started in practice. For the first 15 years, I did nothing but oral surgery, not only in the office, but I was on staff of about 5 hospitals in the Jersey area. We did a lot of facial trauma and maxillofacial reconstructive surgery for jaw deformities and the like. After I came to Yonkers, I wanted to do a lot of crown and bridge and restorative work as well as surgery. So I retired from the board and pretty much do general practice now. But with my surgical training, I do a lot of surgery in my practice, extractions and dental-alveolar surgery in the office. I don't do any more hospital work, however. All of my work is done in the office now.
And I know for myself, it's more like a one-stop shopping, for lack of a better word, when you come to your office for service, because you don't have to be referred to a surgeon to have some, whatever they do done, because it can be all handled within your office.
Here, but there are things that I don't do, that I do refer to specialists who I believe should be doing that. One is orthodontics, where a child needs braces to straighten his teeth out, or her. I refer that to an orthodontist. We have some very fine ones in the area, and that, I think, is where that particular specialty should be practiced. Also, periodontics, gum surgery, patients that have teeth that are starting to loosen, the periodontists are excellent at giving them gum treatments and surgical gum treatments to help them keep their teeth as long as possible. But for the most part, everything else, including implants and the restoration of those implants with crowns or bridges, we pretty much do here.